order. It's 6:02, and I typically wait a couple minutes just to. All right, so we are in order, and first item on the agenda is the call to meeting and then the Pledge of Allegiance, so we'll stand and do that. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. Next up would be the roll call for attendance. Sheila, if you would.
Ms. Bernard.
Here.
Mr. Furman.
Present virtually in Fern, Michigan.
Dr. Guadalupe. Dr. Hahn.
Present in Bloomfield Township, Michigan.
Ms. Newman.
Present in Pontiac, Michigan, attending virtually.
Ms. Namie Dyer.
Here virtually from Farmington Hills, Michigan.
Mr. Cowan.
Present.
Ms. Rue. Here. Dr. Taub.
Here.
Mr. Torres.
Here.
Mr. Lansman.
Here. So we have a quorum. Next up would be a motion to approve tonight's agenda. Will someone make that motion?
I'll make the motion to approve the agenda.
Thank you. Is there a second?
And I'll second that. It's Adam.
All right, thank you, Mr. Furman. So a motion by Torres to approve the agenda, second by Mr. Furman. Is there any discussion? All right, I guess we take a vote. So here we go.
Mr. Torres.
Yes.
Dr. Taub.
Yes.
Ms. Rue. Yes. Mr. Cowan.
Yes.
Ms. Namie Dyer.
Yes.
Ms. Newman.
Yes.
Dr. Hans.
Yes.
Dr. Guadalupe. Mr. Furman.
Yes.
Ms. Bernard.
Yes.
Mr. Lansman.
Yes.
Motion carries.
Thank you. The motion carries. The next item on the agenda is public comment. Do we have anyone that's registered tonight?
Yes, we actually do have some public comment this evening that we received via the electronic form. And the individual had asked for the facilitator to read her comment.
Wonderful, please.
Which is as follows. Hello, my name is Lynn McGinnity, and I am the Executive Director of New Gateways, a community skill building program in Waterford. I wanted to first extend my gratitude to OCHN for continuing to support the provider network in staying whole with the cost reimbursement model. As we all know, these times continue to be filled with uncertainty. As we move towards a new year and the discussion of returning to rate model reimbursements, I would like to briefly update the board on New Gateway's current experiences with COVID-19. Over the past 3 weeks,
Speakerphone, but I don't know how.
if we need to mute some people. Over the past 3 weeks, New Gateways has had 11 positive cases, more COVID-19 cases than we experienced during the entire year of 2020. All positive cases were considered breakthrough, as 92% of our employees and 96% of our current participants are fully vaccinated. New Gateways continues to offer weekly COVID-19 testing and vaccines to all staff and participants, as well as the local provider network. This has allowed us to closely monitor and quarantine those that may be infected with the virus. Despite the weekly testing and high vaccination rates, we have quickly gone from a 75% return rate of clientele to slightly below 40% due to the uptick of positive cases. Our absenteeism rate is averaging roughly around 17% on a daily basis. This makes our revenue and ongoing stabilization of our program fluctuate day by day. I ask that OCHN leadership and their board of directors continue to monitor the situation closely and consider extending the cost reimbursement model for providers beyond December of this year. Thank you for your time.
Thank you very much for those comments. Is there anyone else that's wishing to have public comment at this time? Okay, hearing none, there'll be a second opportunity at the end of this meeting. Thank you. Next up on the agenda is the introduction of Richard Oldacre. Dana?
Good evening. I'm Dana Lassenby, CEO. I wanted to announce and welcome Mr. Richard Oldacre. He is our new Chief Operating Officer. He started yesterday, and part of our leadership team. He will be in leading, planning, directing, and making some of those decisions alongside the rest of the chiefs regarding our programs and our administrative services. As part of the executive leadership team, Mr. Oldacre will also take immediate responsibility for the oversight, direction, and coordination for our provider network team, facilities, training, and other assigned areas as we go forward. He will also be responsible for managing the service and program operations at OCHN, as well as developing and implementing the strategic plan as directed by this board, as well as the annual plan and budget. So please join me in welcoming Richard.
You're welcome.
Thank you.
We'll have to get you a nameplate.
Yes. And I'm not sure if you wanted him to say anything on his own behalf.
If you'd like. Yep, turn on your mic.
Spot already, right?
Gotcha. Thank you all. Good evening, ladies and gentlemen of the board of directors. I'm Richard Oldacre. I'm the new Chief Operating Officer. I'm extremely excited to be here. This is a wonderful organization with a strong history of providing healthcare, behavioral health care to the community. And I believe in that mission. I have a background in working in underserved areas in Chicago, Miami, Detroit, and other places. I'm originally from South Florida. And so Fort Lauderdale, I don't know if Dana just came back. But she had a wonderful time, just so you know. This is a wonderful organization. I'm looking forward to working with her very closely to achieve the organization's mission and its vision. I absolutely believe that this organization can become one of the best in the country, and that's what I'd like to be a part of. And thank you very much for having me this evening.
All right, thank you, and again, welcome aboard. All right, next on the agenda would be Stories That Inspire Hope. Of course, this is my favorite part of the meeting. So I want to welcome Chaco McDonald and Mr. Frank Jones.
Yes.
Okay.
Hello,
Chaco's
everyone.
Just getting up to the mic. Yeah.
All right. Excuse me. Good evening, everyone. My name is Chaco McDonald. I'm the Veterans and Military Families Navigator for Ochn County, and I am here with Mr. Frank Jones virtually. And Frank's going to speak to you in just a moment. That slide that you see right there, as it states, my role is to support veterans and their family members. My father is a veteran, Marine Corps, 2 uncles that served in Vietnam, Army, sister-in-law, Iraq, Afghanistan. So kind of got military kind of running through. Myself did a stint in law enforcement, so understanding more of a paramilitary from a law enforcement background, but quite similar when you're talking about military and law enforcement. So my goal as a navigator amongst the many other navigators in the state of Michigan is to help get our veterans and their family members connected to various resources. So not just resources, but benefits. So as you stated, as you see right there where it's stated, disabilities, these are the areas, some of the areas that I cover in reference to disabilities, employment. I have a job readiness background, did that for over 10 years, prison reentry, helping ex-offenders, individuals that were, being released from incarceration, help them readjust back to society, get jobs, go back to school, did that for several years. Mental health, substance use, support groups. We're looking to hopefully implement a support group very soon, because that was a need that many veterans spoke on. They wanted a group where they can come in and talk. There are groups that exist like that, but typically they're for combat veterans. Well, not every veteran is combat, but every veteran has a like-mindedness in how they served, and from basic training to et cetera. So we're looking to hopefully start that support group soon in 2022. As far as the various resources, in reference to the various resources, one thing that we did, when I say we, myself and other community partners, in the light of COVID, when many things shut down, we realized that veterans and military families still had needs. Michigan, and just Tri-County area alone, we have over 200,000 veterans just in this Tri-County area alone. Ochn County, 58,000 veterans. We implemented resource events, so food and resource giveaways. With those food and resource giveaways, we managed to impact for FY21 over 400 veterans and military families by implementing these resource and care package giveaways, where we allowed the veterans and their families to come, partake, get connected to benefits, resources, thus helping enhance quality of life. So we're looking to, for FY22, I want to, if we can get to 1,000 veterans and military families, that is my goal. If we hit 400, we can double that for FY22. So that is my role as the Veterans and Military Families Navigator for Ochn County, is to make sure our military families and our veterans, regardless of discharge or time in service, get connected to the benefits and resources and services that they desire, that they need and look for.
Thank you. So along with you've got someone, Frank Jones, with you tonight?
Yes, got Mr. Frank Jones. Frank is a Army veteran and served in reserves as well. Frank and I met, I want to say around 2019, Frank.
Yeah.
So it's been a minute, and I'll let Frank tell you his story. Frank's a good guy, good guy.
Thank you.
Yes, I met Mr. Chuck McDonald. He was God sent. I had got myself in trouble with the law because I was having psychological issues. I was also homeless, living in a tent in the woods in Southfield, Michigan, and I was there for too long. I only planned on being there 6 months, but I ended up being there 3 years. My psychiatrist had retired, that I didn't have one. I wasn't on any medication. And I went back to drinking alcohol. He found me temporary housing at a shelter, and then they found me permanent housing with SOS. They got me into Easter Seals to get back on my medication. They helped me with Veteran Affairs because I have 2 bad knees. I was airborne in the Army. My unit of origin was Charlie Company, 1st Battle Line, 12th Special Forces out of Selfridge. I was training to be Special Communications Operations Sergeant, 18 Echo. I'm still seeing Easter Seals. I'm still on my medication, and Chuck is still helping me with trying to get my disability because I injured both my knees, the right one in basic, the left one at Camp Grayling, and I was in the hospital both times, 2 weeks, because my knees was all blown out. he's a very good man, someone I wish to continue to know for the rest of my life. He went the extra 100 yards to help me. When I was trying to deceive the court, not let them know that I was homeless living in the woods, I told them I was living with my sister. And then when they wanted to send somebody out to our house to see if I was there, I said, oh, I can't get her in trouble. So then I finally told him. I'm still adjusting because I'm a paranoid schizophrenic. I was murdered December 31st, 1988 at work. And they brought me back, and I haven't been the same. I continued to drill with the Army. They was hoping I would got better, but they ended up giving me a Section 8 discharge in 92, said I had developed homicidal tendencies and suicidal traits. It wasn't my fault that I got sick. So that's about it. I got stories to tell, but I don't want to take up all your time. Okay, Chucka.
Frank, thank you, man.
Yes.
Thank you. I appreciate your honesty and your transparency, Frank. And like I said, man, from where we
Right,
when we
because
met.
let me say this.
Go
If I
ahead.
wouldn't have ran into you, no telling where I would have been. My probation officers called me the raccoon whisperer because I was down there so long. It was a family of raccoons come by every night, about 18 of them. Grown ones, little babies. And they would fight and fuss and keep me up. But then I got to love them because a couple of them stayed by all night and make sure wouldn't nobody bother me. Like a couple of dogs. One would sit at the foot of my tent. One would sit on top of my tent because my tent was built underneath a fallen tree. So I'm glad I met you. You got sent. We were supposed to have met, but you got me out them dang woods. Because I didn't know how to get out. And I was getting a Social Security check, but I just didn't know how to get out. I went back to my training in the military that Charlie Company had taught me at Selfridge, the Special Forces Group. You know, a friend of mine told me I was in a loop, and I had to get out the loop, but I didn't know how. So that's all, Chucka. You have a nice evening, and I'm going to let everyone go. It's time for me to eat dinner.
Frank, you are awesome. I'm going to just tell you that right now. So thank you. Thank you, Frank, for, like I said, allowing everybody to be able to hear your story and you know, being that brave to, you know, just tell the truth. So you can continue being a rock star. All is well. Enjoy your dinner.
Yeah. Okay, one more thing. What made it easy for me to deceive everyone, Howard House right there in Southfield, down from Merriweather's, because I was behind Merriweather's, where my tent was, they started being open 24/7, so I could come in there and shower and shave whenever I wanted to. Then I went back in my little hole in the tent. Okay, everyone, that's Frank's story. I wish everyone well tonight, and God bless.
Well, Mr. Jones, this is Jonathan Landsman, the chair. I just wanted to take a moment and thank you for sharing your story with us, your trials and your tribulations about being airborne communications, Charlie Company. And I wondered before you drop off if there's anyone on the board that had any questions or comments.
Okay.
And I see at least one hand. Ms. Newman.
I just want to thank you for your service, Mr. Jones, and your honesty. You're a breath of fresh air, and I wish you well in your future endeavors. I myself, like you, came through the doors of community mental health and found a new life as well. So I just want to wish you well and congratulate you on coming out of the woods and coming back into humanity. But thank you so much for sharing your story with us.
Well, one more thing. When I was in the woods, I had no problem going to sleep. But now that I'm out of the woods, I got to take sleep medication to go to sleep at night. And I said, what's going on with that? Okay.
Training.
Thank you. Are there any other board members with comments or questions? Not seeing anything. Again, I want to take a moment to just say thank you, Mr. Jones, and thank you, Mr. McDonald, Chaka, for presenting tonight.
Thank you for having me.
Yes.
Thank you.
And thank you, such wonderful, kind people. I'm glad
Thank you.
you're here to help us.
We'll do the best we can.
Yes, God bless you all.
Okay. Next on the agenda are reports. See, I have this right. So the board chair report. So the board chair report for November 2021. The executive committee met hybrid on November 3rd for our standard first Wednesday of the month noon meeting. It was attended by vice chair and chair of policy committee. I'm sorry, I have this wrong. Attended by our vice chair, Hadas Bernard, our secretary, Adam Furman, and the chairs of our business, operations, and policy management committees. So Rena Nami Dyer and Melchiah Newman. Also attending was our CEO, Dana Lazenby, our chief legal officer, Kalana Ali, and Sheila Barrett, our administrative assistant. We met, discussed, and set the agendas for the November Committee of the Whole meeting, the regular and general board meeting, and for the study session. As many of you know from being on our executive board or attending, we utilize the agenda planning of topics that occurred throughout the prior year's October study session. We also looked at study session topics that folks have sent in asking for topics. So I want to thank Sheila Barrett for prepping the 2022 calendar with the recurring state and other topics that we have. So thank you, Sheila. Again, we used the input from the study session a month ago to actually figure out what belongs for this month, what belongs in future months. The agenda planning also covers topics like stories that inspire. So tonight, with Chaka and Mr. Jones. So as well, we have a greater focus. It was one of the requests was to have a greater focus on individuals served instead of just on the organizations themselves. As well, upcoming contracts and the coordination of the COW meetings with the chairs during that meeting. As you may have noticed last week when we had the committee of the whole, it was each half of the meeting was chaired by the chair of that meeting. If there was something that was getting voted, it was handled by that committee. Discussion was allowed by any board member who was attending. So a little bit of a change to how we execute and operate, but I think that it was a really nice change, and I think it brought a sense of having two committees and at the same time the committee of the whole concept. Additional board updates, 4 of the board members plus Dana plus Christine Burke attended the CMHA Fall Conference in person. Others attended remotely. I found a number of the workshops to be interesting, such as the primary care provider's use of psychiatric consultation services during COVID, so it was telehealth, which, as many of you know, is one of my favorite topics, is telehealth. Meeting people where they're at, the harm reduction in state of Michigan's opioid strategy, which was sort of interesting, but it sounds like the state is still trying to figure out how to operate with their opioid strategy. And the other was I attended the Detroit Wayne's presentation on CIT, so that's our Crisis Intervention Team workshop, which was, and based on their discussion of how they do this training, I think we do a better job training folks. So I just thought I'd throw it out there. Hopefully others hear that too. Last Friday, I shared the results of the October Studies agenda session on the agenda efforts for the 2022 year calendar, along with what's planned for this upcoming month. and December as well. This Thursday, we do have a study session. So whether you are virtual or in person, there's 2 items on the agenda. The first item is Representative Koopa's, and I apologize if I mispronounced the representative's name, his panel, including Dana, our CEO. The second item is a briefing with Ben, our lobbyist, on the outcomes of the recent election, plus other things that we need to be doing. So insight as to who won, insight into how things are organized, and things that we can do as a board. So I said it earlier, but I may not have been that clear. The agenda for each month's meetings are cast, but not cast in stone. It's on the calendar, but again, the executive board meets to look at the agendas for the upcoming month and to address any changes that we might need to meet any pending or urgent needs, or if something has come up that's important enough to put on there as a suggestion by any other board member, or something that comes up from Dana, our CEO. As a reminder, the Metro Region meeting is hosted by Macomb and is about 2 weeks away on Thursday evening, December 2nd. I urge all the board members to attend, whether they do that in person or virtually. There will be more details to come out on that. And then come January 1st, unless the Emergency Open Meetings Act is extended, we will likely again return to the in-person meetings. Okay, that means all of us meeting here as a board. However, until that happens, remember the courtesy for social distancing if you are here, and remember the requirement of all board members to RSVP for meetings. Let Sheila know that you're going to either be here or not. And then as well, that there is a requirement for all board members to attend to all board meetings. Lastly, I want to take a moment and wish everyone, those we serve, those who serve those that we serve, our staff, leadership, and our board a very happy Thanksgiving. And that concludes my report. Next on the agenda is the Business Operations Committee report presented by Ms. Naomi Dyer. You have the floor.
Hello. Yes, good evening, everyone. Thank you, Jonathan. So just giving the report on the information from the Committee of the Whole meeting from November 8th. We started by having a September 2021 financial review that was presented by our CFO, Anya Eliason. She did want to note that the Budget and Finance Department is starting their year-end process, so the financials that she shared at this meeting were a very rough draft. That being said, the MDHHS payments we're showing trends that were consistent with prior months, showing an increase in payments and revenue, and the eligibility trend is still higher from last year, also consistent with prior months. She did note that the emergency order is still in effect. No one will be coming off of Medicaid eligibility because of that, and she's expecting to see an updated rate certification letters in January to reflect the increases in the DCW wages. Overall, cash and investments were up and receivables were down. Liabilities were down from previous year, but she did want to note that as the year is closed out, she will expect to see those liabilities increase a little bit. The net position is showing an increase, and just the net income has increased from the previous year as well. From there, we discussed a couple contractual obligations. First was presented by Edna White, was the OCHN benefit package, in which she wanted to get committee recommendation for full board approval. She discussed the projected cost for the 2 plan offerings for both with a self-funded HRA and prescription HMO options. Overall, the proposal noted no increase to employee pricing models. And she did request at the time that we consider voting on the approval, so not just voting for the the obligation to be presented to the full board, but she did request that we consider voting for full board approval at that meeting based on the timeline for being able to present employees with the different options. And so because open enrollment did begin that past week. So at the time, a motion was made to adopt the recommendation first for full board approval. And that carried. And then we also then made a motion to actually approve the benefit package, and that carried as well. The next item that was discussed was for the CCSU construction for the approval for the Di Maria building contract. This was presented by Patrick Franklin. This was a one-time renovation contract term in order to renovate the facility for the additional children's services. The space was identified at the RCC and an architect was hired to complete the drawings. They did have an RFP in which I believe, yes, 4 bidders were presented, and Di Maria scored the highest in the process. The total cost of the build out was for $1,498,000, plus an architect fee of a little over $36,000 for a not to exceed amount of $1.6 million. And that proposal was moved to be discussed during today's meeting for full board approval. And that is it for my report.
Thank you very much. Next item on the agenda is Policy Management Committee's Chair Report by Ms. Newman. Please, you have the floor.
Thank you, Mr. Landsman. Under Policy Management, we had the fiscal year 2021 satisfaction outcome report from the Michigan Consumer Evaluation Team. This item was presented by Wendy Schiller and Lindsay McCracken. And there was discussion about how the MSET operators did the surveys, what outcomes they had received, what challenges that they had. They also talked about the experience of care and health outcomes survey, the ECHO survey. And it goes out to, on a yearly basis, it goes out to between 600 and 800 people from different populations, adults with substance use disorder, adults with mental illness, adults with intellectual and developmental disability, children with serious emotional disturbance, as well as children with developmental and intellectual disability. Wendy and Lindsay provided data that outcomes of the survey results, and it can be found in the board presentation. Out of the 1,200 people surveyed, responses totaled 722. There were 4 areas identified for improvement. Goal number 68%. Okay, I won't go into that. We also had a presentation by Kimberly Flowers on the Children's Crisis Stabilization Unit update, and she provided the board with the announcement that the new unit was going to be constructed at Common Ground in the Resources Crisis Center. It's going to be a 24-hour, 7 days a week service. There was a $5 million grant from SAMHSA for this effort, which was wonderful. And services are scheduled to start February 1st, but they do have an ability to extend the start date, considering they have not started construction as of yet. And I believe she said it was going to be a 10-bed facility. And that concludes my report.
Thank you, Ms. Newman. All right, that concludes our chair reports. The next item on the agenda is an approval item. Before we go there, I just want to repeat what transpired at the committee of the whole meeting regarding the benefits, which is our employees are now in open enrollment. But the board at the committee of the whole, first the business ops committee voted to approve. Then there was a motion for the board that was in attendance to vote on approving the Blue Cross contract. Then they voted on that and it was approved. So we are in an open enrollment with that benefit package for our employees at this point. So that was the action that happened at the committee of the whole. So an unusual kind of thing. Normally we do those at this meeting, at our general board meeting, but because of the urgency, we took that action at that meeting. Okay, so on to approval items tonight. So the Business Operations Committee did vote out of their committee a recommendation for the approval of the Ccsu. So that's the Children's Crisis Services construction addition to the building in Pontiac. So what I'm looking for at this point is, based on that motion or based on that vote by the Operations Committee, someone to make the motion to approve the $1.6 million. That's $1.6 million for the CCS construction project. Ms. Namie Dyer, you're the chair of that committee. Would you like to make that motion?
Yes, I will make that motion.
Thank you. Is there a second?
Second.
Thank you, Dr. Taub. So there's been a motion made for the construction project approval for $1.6 million. Motion by Ms. Namie Dyer, second by Mr. Taub. Is there any discussion on this?
Jonathan, it looks like Hadass has her hand raised.
Thank you very much. I appreciate it. A couple hands raised, so it's so far away from me. I think is that Ms. Bernard?
Yes. So I think
Okay,
at the end
you.
of the meeting, the question was, what's the square footage of the space that we're renovating?
It's, do you want me to speak to that?
If you have it, yes, Sheila.
Yeah, it's 7,400.
7,400 square feet?
Yeah, and I apologize, Ms. Bernard. I provided Mr. Cowan that information, but I didn't provide it to the full board.
No, that's okay. I had other questions, and what's existing there right now, and probably Dana knows, but I forgot what is happening to what's there right now, or is there nothing there right now?
Ms. Bernard, this is Dana. What's currently there are 2 crisis beds for children, and what the expansion would do would expand it to 10 beds in total. So in the entire county, we only have two children's crisis beds. Other children are being directed to go to the hospital EDs, which we know can be disastrous. So this would expand the ability to provide that service.
Okay, I just want, so we're adding on to the building? That's the part that I just can't picture in my mind. I just wanted to understand.
We're renovating
so
that we can have we're renovating so that we can have a specific unit to serve children in crisis. So we're building the actual Children's Crisis Stabilization Unit, which will allow us to begin to treat children as soon as they walk through the door. Currently, what happens is that they are assessed and determine whether or not they need hospitalization or some other level of care.
So we're repurposing part of the building to cover this?
Yes.
Okay. Do we know what that part of the building was before?
Yes, it was where our access team were sitting during phone calls to screen people who wanted to receive services through the community mental health.
Okay. Did that answer your questions, Ms. Bernard?
Yeah, it did. I just want to know, where are those access people sitting now? Where will they move to?
Right now, they're working remotely, and we would still have space there at the RCC as well as space in our building here in Troy.
Okay, and then finally, I'm 100% supportive of this, but I had asked this, I just wanted to know, so will they be the organization that will be building this? Will they be paying us rent?
The organization that will be building it, no. The organization
No, I
that's
mean-
the service provider, I believe they will
Correct.
be paying. Anya could answer that question. I don't want to.
Anya's coming up to the mic right now.
misinform you.
Sorry, I'm just waiting for the high sign to go. So the way this will work is, much like what we do with Common Ground, is that a portion of their payment is for the rent and maintenance and utilities for that space. So we will essentially pay the provider to pay us back. That way it gets rolled into the service costs and it doesn't sit in our administration. So currently a portion of Common Ground's payment is for rent, maintenance, and utilities. We'll do the same thing with New Oakland for their proportion of that building. So essentially they pay us back the rent, and that's in order to account for it appropriately.
Okay, thank you so much. End of my questions. That's the end.
Thank you. Are there any other board members with questions or discussion on this item? All right, not seeing any, let's do a roll call vote, please, Ms. Barrett. Yes.
I don't know who made the motion or supported.
The motion was made by Ms. Namie Dyer. The second was Dr. Taub.
Okay, sorry, I missed that part. And can I just read back the motion so I have it clear? So I have Ms. Namie Dyer made the motion to approve the not to exceed of $1.6 million for the build out of the Children's Crisis Stabilization Unit.
Yes.
Okay. Ms. Bernard?
Support.
Mr. Furman?
Support?
Dr. Guadalupe? Dr. Hans?
Yes.
Ms. Newman?
Yes.
Ms. Namie Dyer?
Yes.
Mr. Cowan?
Yes.
Ms. Root?
Yes.
Dr. Taub?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. I think this is it on approval items, so we move on to the next item on the agenda. And this is the consent agenda, and so this is for acceptance of October meeting minutes, recipient committee of the whole, the recipient rights advisory committee meeting minutes, the citizens advisory meeting minutes, the oversight policy board meeting minutes. And the approval of the board meeting minutes from 10/19/2021. So at this point, I'll look for a motion to approve the consent agenda.
So moved.
Thank you, Mr. Cowan. A second?
I support.
Thank you,
I
Ms.
second.
Root. As a consent agenda, there is no discussion, so we move right into roll call.
Mr. Torres?
Yes.
Dr. Taub?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes.
Ms. Namie Dyer?
Yes.
Ms. Newman?
Yes.
Dr. Hans?
Yes.
Mr. Furman?
Yes.
Ms. Bernard?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. All right, now we move into the next item on the agenda, which is committee reports. So the first one is the Recipient Rights Advisory Committee. Ms. Root?
So I attended in person on Thursday, November 4th here at the OCHN building. And included in the agenda for the evening was a presentation by Linda Bartoloni-Till and Patrick Franklin about Medicaid and OCHN Medicaid funds. So we reviewed a few general points about how Medicaid works and then how the OCHN revenues and expenses budget breakdown. And then the Rights and Advocacy Director
shared that the department successfully concluded a training series for the year, and planning will start soon for trainings in 2022. The rights manager then updated the committee on a staff member's upcoming retirement and also on their annual report process, which is close to being completed but not quite yet. And we were then updated on the rights assessment, which we did not overachieve on, as I learned this department often aims to do, but we did mostly satisfy requirements for the 11 sections of the assessment. And I wanted to share with you one great comment we received, which was that OCHN is setting the tone for timeliness across the state. So that's a great highlight for us to focus on. Next, we were provided with the September site visit report, and 100% of service sites requiring a site visit have been completed. Our committee has an additional meeting this month, which is scheduled for November 29th, where Mark Friedman will provide a mentor training session. And this was a topic that the RRAC had previously chosen, so we're looking forward to it, and I'll update you next month on how it goes. Thank you.
Thank you. So, question for you. So you're meeting at the end of the month. Does that mean you will not be meeting at the first week of December, or you will as well?
No, we will as well. This is an additional meeting.
Okay, thank you. So again, note that if anyone's interested in attending that Recipient Rights Advisory Committee meeting. Next item on the agenda is the Citizens Advisory Committee. If you would report out, please, Ms. Namie Dyer.
Yes, I was actually not present at that CAC meeting last month, so I don't have a report. Tomorrow will actually be the first CAC meeting that I will be attending, so nothing to report at this time.
Okay, thank you. And then we have Substance Use Oversight Policy Board. Mr. Cowan?
Yes, thank you. I'll refer the board members to the full text of the minutes, but some of the highlights were Christina Nicholas gave a comprehensive update on the SUD strategic plan. We spent considerable time speaking about the credentialing standards for service providers, and that was quite an eye-opener. And then because of the fact that we have 2 county commissioners that are on that body, there was an update when the update occurred on the Senate Bills 597, 598. Both Janet Jackson and Mr. Spiz, who had this came kind of at the end of the meeting. He was not present, but I know that Commissioner Jackson followed up with them, and within a matter of, and I know others had been working on this, but we had what this resulted in was that the Oakland County Board of Commissioners voted on a proposal at their November 10th meeting, a resolution opposing 597 and 598. Now, I did not get verification on that until Sheila gave it to me this evening, but I thought that was a unintended but great consequence of that meeting, along with other efforts that people have been making. But we just happened to have 2 commissioners on, in attendance, so that we could bring that to their attention. So it was a good meeting, and Chairperson Kelly Flynn runs a good meeting and got us out of there in 2 hours.
Wonderful. Thank you. All right, and the last committee report is with the Bylaw Committee. John Paul Torres.
Thank you. We've been meeting regularly these past several months as a Bylaw Committee, some months twice, generally once a month. We have our upcoming dates for our next 3 Bylaw Committees meetings through the end of the year. So the next will be on November 22nd from 12 to 1:30, December 8th from 5:15 to 6:45, and then on December 20th from 5:15 to 6:45. We have made it through several of the sections of the actual bylaws, board officers, committees, administrators, organizations, meetings. Our plan is to finish the last two sections of our bylaws and then move into policy, which is going to allow us to expand more on some of the context in the actual bylaws. We have a solid group of people who are on this committee, all contributing. We don't always agree on everything, and we often do have disagreements, but we end up coming to a consensus, and I think the end product is going to be better for that. Any board member that is interested in attending can do so at any of those meeting days and times. It is in compliance with the Open Meetings Act, and you can attend virtually. Thank you.
Thank you very much for your report. Next up on the agenda is, I believe, the director's report. So
Good
Dana,
evening.
you have the floor.
Thank you. Good evening again. I do want to thank this board tremendously for the amount of support that you all provided, especially as we pursue those strategic priorities that relate to access and crisis, which really aligns with us getting the crisis stabilization grant and being able to build out the Common Ground, or the Resource and Crisis Center where Common Ground is also located, and actually begin to provide those services, hopefully early next year. That is the goal. Also, I agree with Mr. Cohen in the work that we were able to do in the Oversight Policy Committee meeting really did seal the deal. We did do some sideline work in working with the Board of Commissioners and meeting with Mr. Woodward, but really that meeting enabled us to really reach out. Ms. Taub, I cannot thank her enough for really reaching out to people and making those phone calls to make sure that we got approval of that resolution. So as soon as we get that document or a copy of it, we'll share it with this board. That is going to be hopefully a big push so that we can continue to fight against the Senate Bill 597 and 598, which is their the attempt to privatize the community mental health system. Also, I want to say we're continuing to work very closely with the Board of Commissioners and the county execs team in terms of looking at pilots and programs that we can expand upon using those ARP dollars. So we have successfully secured funding related to the co-responder programs, and then we have a pending approval for the Mental Health School Navigator program, as well as through Senator Bayer's assistance and advocacy, we have a violence interruption program, which also is bringing in $250,000 to specifically address programs that would prevent violence in the home, and in the community, and then gun violence as well. So as we continue to work with our core providers, I actually met with 6 of the core provider CEOs last week. So that included CNS, CLS, Easterseals, MORC, TTI, and Common Ground. So that is something I think is also very critically important for us as we look at the ARP dollars and going to the community and asking what programs and services can we expand on or begin to pilot while the funds are available to start those things up. So with that, I have a lot of details in my report, but I really wanted to highlight those accomplishments and those things that we're continuing to work and move forward with. And I'll take any questions.
I don't see any hands up, but thank you for your report.
Thank you.
All right, next item on the agenda is a second opportunity for public comment. Is there anyone?
Actually, yes, we did receive an additional public comment this evening
Wonderful.
in the online forum. And the public comment is from Robin Trimper from Freedom Works Opportunities, Inc. And she has asked that I read the comment for her. Our vocational program has made great efforts to fully reopen, but are finding that we are continuously up against a number of uncontrollable roadblocks. Some individuals are still hesitant to return, homes are struggling to transport, or dealing with their own exposures, and we're seeing more cases of COVID-19 than ever. Today, meaning today, 11/16, our absenteeism rate was over 40%, with an average being 15 to 20% daily. I would like to say that I am also very appreciative for the additional support that OCHN has been providing. I would like to ask for your consideration to extend the cost reimbursement model for your providers, which was slated to end December 31st. Thank you for all you do. Robin Trimper, FreedomWorks Opportunities, Inc.
Thank you very much for that public comment.
And I do not see any additional public comment in the chat this evening, but customer services will be responding to the public comment that we received this evening. Thank you.
Right. Thank you. Next item on the agenda is board member comments. So if we go through the list, Sheila.
Ms. Bernard?
Hi, yes, I want to thank everybody for the meeting, and then also I'd like to figure out when we can have a discussion about the cost reimbursement model as to if it's possible to do in any realm in 2022. I think that needs to be discussed on the business ops and with finance based on the two comments that we were given today to the public. But thank you and have a wonderful night.
Mr. Furman?
Yes, I'd just like to once again thank all the staff people involved in putting the board packet and presentations together, specifically Mr. McDonald and Mr. Jones tonight. Like our chair mentioned earlier in the evening, it's really a highlight of our monthly meetings to have these stories that inspire, and it always validates the work that we do at OCHN. So thank you very much and have a good evening.
Dr. Hans?
I also wanted to thank all the people who presented today. It was very informative. As we heard in the public comment at the beginning and at the end of the meeting, and also in the news that we are hearing that the numbers of COVID cases are slightly going up in the state. So I think we should resume giving some information as to how the people that we serve are doing, if there is any increase in the numbers. My second concern is about the vaccination. I think that is important. And that we also keep up with that. And the third thing is flu season is almost on us, and I think that is also something we should be looking into. I've learned recently that although most of the pharmacies are providing the flu vaccine, but a lot of the pharmacies are not accepting Medicaid recipients for their vaccination. So if we could start a clinic somewhere, as we did for the COVID vaccine, I think that will be a great help to our community. Thank you.
Ms. Newman?
Thank you, Sheila. I just want to wish everybody happy Thanksgiving, and I have no other comments tonight.
Ms. Namie Dyer?
Thank you, everybody, for all of the different reports and presentations, and have a good night, everyone.
Mr. Cowan?
I was able to attend the Veterans Day ceremony in Royal Oak, which was actually a gorgeous day, and about 300 people. And our speaker was an Air Force veteran who's now in the reserves. And he spoke of his time of service, including active duty in Iraq, but he also spoke very openly about his reaching out for mental health assistance and urging all the veterans there. And I thought that was a great act of courage for someone to say that in a public forum. It's easy to say it in a small group, but it's hard to get up and say that. And I felt very proud of the fact that this organization and what we saw tonight with Chaka and Frank, that we're doing what we can to help serve those who served us. So it was a kind of full circle today when we had that presentation. And the second thing is, I on a personal note, I have a new job. I am transportation for my son Danny to get from his home on Mondays to CEO in Pontiac. I've gotten to know the workers in Pontiac a little bit, and I commend the CEO for doing everything they can to open up their center more and more to those in our community that need to get back to their jobs, so to speak, at those centers. So it's not even an inconvenience for me. I enjoy the time with my son, but I did think about all those who maybe don't have the flexibility that I may have. And this is directly related to the fact the transportation company doesn't have enough people to provide service on Mondays. So, it's a continual battle, and Dana, I know you and all the service providers, we just have to fight through this. I hope the raise helped for many of our workers, but this is a continual issue that I think is here to stay for a while. And thank you.
Ms. Root? So I echo the comments about having a conversation about the cost reimbursement model, and also making sure that we're advocating for individuals to have access to the booster shots. And I know they're not here anymore. I was just trying not to cry when they had their presentation, so that's why I didn't say anything. But I am so grateful that Mr. McDonald and Mr. Jones got to share their story, especially because there's such a stigma related to mental health in the veteran population, and it just breaks my heart. My stepdad is a Vietnam War veteran, and I'm a social worker, so I can see it, and I can see the difference in a veteran who has access to resources and has been able to heal versus someone who just feels like they can't do that and they can't share and reach out. So again, very grateful that they were here with us tonight. And then I want to say welcome to Richard. We're so happy to have you. And then lastly, I just wanted to share this. I am going to start working part-time in a Pontiac elementary school, and this is through Honor Community Health. So my employment is still being managed by the Multicultural Family Center, but just in case there's ever a time where I shouldn't vote, if it's related to Honor Community Health due to possible conflict of interest, I wanted to bring that up so, you can help make sure that I don't cross a line or anything. But yeah, I'm excited. I'll be a clinician there, providing services in English and Spanish to families. So really looking forward to it. Thank you. Dr. Todd?
Welcome, Mr. Oldacre. And nobody told you it was going to be easy. So, secondly, what Bajai was saying about the flu shot, the Vietnam Memorial's got 56,000 names on it. In an average year, we lose about 45,000 people. In a bad year, 110,000 people to the flu, mostly non-vaccinated people. This might be a really bad flu year since we didn't have most people didn't get a flu shot last year, or the flu, so they don't have any resistance left from that. And apparently, no controlled studies on it, but the feeling in the medical community is that having the flu shot and the COVID shot sort of help each other out. So consider getting your flu shot. I mean, if you walk near me, you just get immune from all the shots I've had. So. And happy Thanksgiving to everybody.
I need to walk towards Dr. Cobb. Mr. Torres?
Thanks, everybody, and congratulations on the new position, Mr. Oldacre, and welcome aboard. I think you had a pretty tamed meeting tonight, so that's good. So pretty quiet one. But I just want to reiterate the recognition to the veterans, and this month being us recognizing Veterans Day. My father's a veteran. And I've worked in the criminal justice court system for my entire career. And just over the years, that's really what drove me to get involved into community mental health. And early on, I would see the veterans come in, a lot of the Vietnam War veterans, mental health transports, or involved in the criminal justice system. As years would go on, I started to see a lot of the younger generation coming in after Iraq and Afghanistan, and many of them were opioid addicted and would be in my mental health court. Eventually, they started creating veterans court programs, which have been a godsend for veterans because they're run by veterans and people that understand veteran issues. And to this day, now seeing that older population like my father, who's almost 80 now, and getting them the help that they need and the services that they need to be productive members of society. So it was nice to hear the story, and it does inspire true hope. I want to also recognize everybody on our bylaws committee again, as I iterated before. But I also want to recognize Kalana and Sheila and Dana for their efforts in it, because you guys have been integral in helping us, pushing us in the right direction, steering us, and giving that input and that information. And Sheila with her organization and her help, and Kalana with all of her legal background and analysis. So, just looking forward to seeing everybody. Hopefully the pandemic gets better. We were talking before the meeting earlier that come January we might be back in person. We don't know where that's going to go, but hoping that the pandemic numbers get better, we can get back to some form. Well, we are at some normalcy, but to complete normalcy someday. Thank you.
Thank you. Mr. Lansman.
Thank you. So I want to thank the staff and the leadership and the folks that serve others. It's a tough job out there, and I know that whether folks we serve say so or not, I know they're very appreciative. So thank you very much for all the hard work you do. Thank you tonight for Chaka and for Frank for sharing his story. It's not easy. Vets, there's a number of folks here that are vets or have been. So it's a tough thing. Come back with all kinds of wounds, whether they're visual or not. Just want to take a moment and say some comments. This past week we learned that Christina Nicholas is resigning after 20 some odd years in the world of substance use, including 7 with us as our Director of Substance Use Disorder Services and another 14 working for the county. So she has chosen to leave Ochn. Her last day is next Monday, the 22nd. Just want to say Christina's done a wonderful job, an amazing job in providing vision and organization, suggesting and then leading, directing where and how we and the county and Okema and now Ochn can and have, have worked with other entities through innovation and execution to address substance use and other challenges that persons in our county and across the state have faced. Even with her leaving, that's not going to change. We're going to need others to step up in the organization and help fight the battle and help the public as well as the 27,000 folks that we serve get through these challenges, not just because of COVID, but just in general, they're there. I've always been amazed by her imagination and critical thinking to seek solutions and to mobilize efforts. It's been pretty amazing. I know I can't use that word enough. I can't recall any effort that ever failed, even when we didn't have adequate funding for it, as she always found a way to make it work and found others to help and to keep those things sustainable. So I hate to see you go, but we are grateful for your work and the leadership you've provided, so thank you. I'll speak for the board and the leadership, we wish you the best in your next endeavors wherever you're heading, so thank you. Last, I want to welcome you, Richard Olaker, to our leadership team here as COO. I think you'll find it an interesting experience. Dana runs a tight ship. It's innovation, it's agility, it's adaption, adoption, and adaption. Adapting and adoption, there we go. So adaption, how's that for a new word? So I think it's going to be fun. I don't know if I said it before, but welcome Ms. Flowers because I don't think I publicly said that on any of my comments, so thank you, and glad you're here too. Always glad you're here. And so with all that, I'm going to say happy Thanksgiving to everyone, and we'll see you after that break. Okay, so we're at the last item of the agenda, which is a motion for adjournment.
So moved.
Thank you. Is a second?
Support.
All right, thank you.
Jump.
All those in favor?
Aye.
Aye.
Any opposed?
Aye.
Okay, we're adjourned. We're in adjournment.